Shall we start, ma'am? Ma'am, am I audible?
Yes, you are audible. Just a moment. We'll start.
Okay, ma'am. Sure.
A very good afternoon to one and all over here. I am Dr. Neha from IAP Digital Media team. I will be the host for today's webinar on. Now, today's webinar we have that is being organized by Tamil Nadu State Team of IAPWC, and we have with us today Dr. P. Senthil Kumar sir, who would be speaking on the topic Healthy Heart, Healthy Aging, the Key to Longevity, as we are having this webinar series on occasion of World Physiotherapy Day. The Indian Association of Physiotherapists is the oldest and largest association representing physiotherapists in India since 1955. The IAP digital media team consists of a group of physios who handle Zoom platform, webinar live streaming, and IAP profiles on social media platforms that is Facebook, Instagram, Twitter, LinkedIn, YouTube. Now follow IAP profiles on these social medias to receive notifications for our events such as webinars, workshops, CMEs, conferences, health camps, blood donation drive, and to know about the recent updates on physiotherapy. We would also insist you to subscribe to our channel, IAP YouTube channel, for notification of our live webinars. In the playlist section of this channel, webinars are segregated into various folders on topics like orthopedics, neurology, sports and fitness, pediatrics, cardiopulmonary, women's health, research, cancer rehab, etc. for the easy access to all our students and professionals. The social media links would be shared in the chat shortly. Now, I would like to hand over further for our today's moderating sessions to Dr. Sophia Martin, ma'am. Ma'am, over to you. Thank you.
Thank you, ma'am. Good afternoon, everyone. On behalf of the Indian Association of Physiotherapists, Women's Health Tamil Nadu, I, Dr. Sophia McConnell, extend a warm welcome to all of you. We are delighted to have you with us for day 2 of a special webinar series. This series has been thoughtfully designed to bring together experts in physiotherapy to share their knowledge and guide us in advancing our professional journey. It is indeed a privilege today to have with us our distinguished speaker, our resource person, Dr. P. Senthil Sir, Professor and Dean in charge at the Wales School of Physiotherapy, Tamil Nadu. Dr. Senthil Sir has over 18 years of extensive experience in clinical practice, teaching, and research in physiotherapy. His expertise lies in postural evaluation, geriatric rehabilitation, and cardiorespiratory physiotherapy. He has guided numerous PhD scholars and postgraduate students. He has contributed to research with more than 50 publications in reputed journals, authored books, and even holds a patent in artificial intelligence based health diagnostics. Recognized with multiple awards, including Best Researcher and Distinguished Service Award, he also serves a reviewer and editor for leading national and international journals. We are truly honored to have such a dedicated academician, researcher, and mentor with us today. I am certain that his insights will greatly benefit all of us. Ladies and gentlemen, please join me in warmly welcoming Dr. P. Senthil to deliver a session for day 2 of our IAPWC Tamil Nadu webinar series. Over to you, sir.
Thank you, Dr. Sophia, madam,
My
and
pleasure,
Neha,
sir.
madam. Yeah, is it audible? I am clear.
Yes, sir, you are.
Yeah. First of all, I would like to thank the Indian Association of Physiotherapists, Central IAP, the President, Dr. Sanjay K. Jha, and National Head IAP Women's Cell, Dr. Ruchi Varshini, and also the South Zonal Head, Dr. MC Mercy Jayaprabha, and also my sincere thanks to Dr. S. Parvati, IAP Women's Cell, Tamil Nadu team, State Head, Dr. S. Parvati, and Dr. K. Pradeepa, Joint Coordinator, Dr. Jayasri Jayakrishnan, Sub-Coordinator, and Dr. Chandralekha, Sub-Coordinator, Dr. R. Bharati, Sub-Coordinator. And thanks for Dr. Sophia giving a nice introduction. First of all, I would like to wish all the physiotherapists and the audience who are all in this webinar platform very best wishes for all the for the audience World Physiotherapy Day wishes, and I congratulate all the IAP Women's Cell coordinators for conducting this 1 week of webinar series, and the topic and the experts were very tuned and a very needed one also. So, on behalf of this webinar series, uh, my topic is on healthy heart, healthy aging, which is suitable to the theme of our World Physiotherapy Day, healthy aging, which is a key to the longevity. So this is my topic. Uh, whether the slides are visible.
Yes, sir.
So the objective of this today webinar is to understand the link between cardiovascular health and aging. The second objective is to explore modifiable risk factors for cardiovascular diseases. And third is to highlight the role of physiotherapy in prevention and rehabilitation phase. And fourth, to discuss practical intervention for promoting healthy aging. Why cardiovascular health matters? We all know that the cardiovascular disease is the leading cause of death globally. And even after COVID, even the young generations are having a cardiac arrest and a heart attack. So, which leads to mortality in young age also. So, the aging the population, again, the more the risk. or higher the cardiovascular disease burden also. So if cardiovascular fitness, like which influences quality of life, independence, and cognitive function. So the ultimately, being the therapist, we need to take care of take the responsibility to take care of the cardiovascular diseases or problems in the population, and need to identify early with our examination and preventive or intervention protocol, which makes them to be more healthier and having a healthy longevity. So what is healthy aging? So according to WHO definition, the healthy aging is nothing but a process of developing and maintaining functional ability that enables the well-being in older age. So the in geriatrics, if they are more independent and they are doing the routine activity, our physical and as well as mental system, which helps to uh, adapt to the social health and the regular activities, community activities, then it is called as a healthy aging. So it includes not only physical, mental, and even social health, healthy participation. Aging and cardiovascular system. Usually, the cardiovascular system play a major role uh, to function which is a vital organ which supports the entire other systems to function smoothly. As the age increases, some of the normal age-related changes happens in the cardiovascular system. Some of them are arterial stiffening will be happened because due to uh, high hyperlipidemia and atherosclerosis formation. In addition to that, reduced cardiac output will be there, and which again slower the baroreceptor responses. In addition to that, as the age increases, their predisposing hypertension, heart failure, stroke will also be gradually increased. Some of the risk factors of cardiovascular diseases are, we all know that it has been classified into modifiable and non-modifiable. In case of non-modifiable, it relates to age, genetics, gender. Whereas modifiable risk factors like sedentary lifestyle, smoking, poor diet, obesity, stress, and diabetes mellitus. Everyone need to understand the modifiable risk factors. We can focus more on these areas so that we can able to uh, make the better lifestyle, betterment in the lifestyle, so that the cardiovascular diseases or burden can be reduced. Even some studies nowadays, it is been focusing more related to gene therapy or chromosomal related alignment, where some few exercises which helps to change their genetical markings. But still, it has been in the research review. So, but definitely, if it has been proved, so the scope for us to make the non-modifiable risk factors also play a major role. So, how comes the longevity and heart health? There are many studies has been done to maintain the longevity, and several vital organs are responsible. The important vital organ is cardiovascular system. The heart healthier, the longevity can be increased. One of the study where they have been identified if more the VO2 max uptake and a regular physical activity, definitely the longer the lifespan will be happen. So definitely If we have more the physical activity, uh, indirectly we can take VO2 max uptake can be increased. Once the VO2 max uptake can be increased, all the other vital organs function smoothly, which indirectly it reflects on longer the lifespan. One of the research says that blue zones, communities with the longest life expectancy emphasis, they have been given some feedbacks from this blue zone community, and they received a feedback that regular movement, any sort of movement, a small free exercises daily they have been spending in their lifespan, and plant-based diets. In addition to that, stress reduction management they have been following in day-to-day life activity, which promotes them more the life expectancy. And similarly, a research focused on centenarian commonalities, where above the age of 100 years population, they have given a statement that if we are active, especially socially engaged, a more less chance of cardiac diseases. So this shows that we need to focus more towards the physical activity enhancement, and in addition to the physical activity, we also need to have a holistic approach on our lifestyle management, which emphasizes stress reduction and proper dietary management. This is a key role for keeping the heart healthy, thereby longevity can be increased. Now comes here, what is the role of physiotherapy to make healthier the heart? As we all know that cardiac rehabilitation programs has been tuned, and separate individualized exercise programs can also be prescribed, and even based on the regular monitoring of the vitals and their progress, we can structure the tailored program of rehabilitation exercises. In addition to that, we can also go ahead with the patient education and lifestyle counseling, which gives more better the enhancement of the lifespan. As we all know, this cardiac rehabilitation program, which is being tuned very nicely into different phases based on the individuals and needs of the individuals. For example, if the geriatric patients need of a more of a healthy lifestyle, they can be trained with a safe zone of aerobic exercise at least 30 minutes per day for 5 weeks of a day or alternate days. In addition to that, if they require some muscle strengthening exercises also, a few safer anaerobic exercises can also be done on alternate days for 5 days of a week, which will maintain them a healthy cardiac. And similarly, being the physiotherapist, we can able to regularly monitor the vitals, and also based on the vital signs and based on the nature of the patient medical history and their associated comorbidities, we can tailor individualized exercise protocol so that to improve their physical activity and thereby to maintain their healthy heart and longevity. In addition to that, we can also go ahead with the patient education and lifestyle counseling, which is very, very important because it's not an easy thing to improve the physical activity for a sedentary lifestyle person. That too aged, they will be more of having fear. So in that case, we need to counsel them properly and give them a very good education about the importance of physical activity. Motivation sessions should be done among the peer groups, and even a group therapy can also suit to them to improve the longevity of their cardiac health. And in addition to that, stress management also play a major role. So in order to reduce the stress, some other combination or a holistic approach of addition to the therapeutic exercises, we can also guide them to do a regular stress reduction managements like yoga, a simple meditation techniques, or even focusing more on pranayamas, which is a very, very important. Even we have been trained during the COVID time for the affected patients to do a pranayama, which shows a very good improvement also. So this should be tailored according to the individuals who need, and not only for the geriatrics. Even nowadays, the youngsters, younger generations are also being lesser having the less physical activity, thereby which promotes some heart, not unhealthy heart. In addition to that, their lifestyle also been changed. Even if you see, recently a few cardiac surgeons also been expired at the young age because of a heart attack. So definitely we need to be more caution about this, and we need to take a pledge to have all the physiotherapists to be um, a human medicine and not prescribing the physical medicine. So human medicine nowadays it's a newer concept where not only we are going to teach the exercises, we also need to have a touch with the patient with the proper counseling, proper education, which makes them improve their healthy lifestyle. So today's my keynote is uh, we all need to be as a human medicine and connect with the people and make the counsel them such a way, motivate them such a way. A regular physical activity should come not only for geriatrics, even for a healthy younger people also, so that the cardiac health can be maintained and thereby the longevity can be improved. So I am very proud that being a physiotherapist, we have a vital role to tailor and give a structured exercise protocol, and even along with the other team of people, we can motivate the individuals to do their regular cardiac healthy exercises. Here, one of the example here I mentioned uh, for a exercise prescription for older adults. What are the exercises we can follow? Aerobic exercise can be taught, and how the aerobic exercise can be taught 150 minutes per week, and we can go with the moderate intensity. And here I also want to add a few points that many people, even they have been dying in the gym because of over exercise or because of the inadequate intake or over intake of other supplements, so which affects heart and thereby cardiac attack happens, yeah, and the yeah, spot of the gym itself. So definitely, being a therapist, physiotherapist, we need to make sure that the healthy conditions should be assessed first, based on the evaluation, based on the condition of the patient. We need to give a proper aerobic training, and in addition to that, if required, strength training, two sessions per week for all major muscle groups also can be given. If you take a geriatric patient, balance and flexibility also can be added in the protocol so that uh, all prevention can be done. In addition to that, which is a very important factor where the physical inactivity happens, and the community participation will be that in the geriatric population. So a balance and flexibility should be trained such a way it can maintain independence in their life. All this can be followed, as we all know that, based on the American sports medicine. classification. Fit principle can be followed, and a proper dosage of the exercises can be taught to the individuals. Fit principle is nothing but frequency, intensity, and time and type of the exercises which we are preferring. That is also very important while prescribing the exercises. So here I kept a case example, a brief case of 68-year-old underwent a post-CAPG recently. So what is our intervention plan and the functional outcomes after 12 weeks? Just I need an opinion from the audience. You can chat in the chat box. You give your view of what are the exercises can be prescribed based on the situation of this patient. A brief case of 68-year-old post-CAPG patient. What is the intervention? The functional outcomes, how it can be measured. So in this case, a very thorough evaluation is very important. Since the patient is older, we need to analyze the other comorbidities, medical history. In addition to that, even bone density, since osteoporotic stages, and the CAP. In some cases, for example, if the CAPG along with that, some complications are there, more complicated surgery, then we need to tailor the exercise such a way the prognosis can be achieved compared to the routine post-CAPG patient, because additional care should be taken because they already they will be in a more depressed state, and the comorbidities are also been added. So we need to focus along with the comorbidities treatment and the post-CAPG exercise management. Thorough examination which gives us a clear picture of the nature of the individual and their comorbidities or the risk factors, and thereby we can structure a protocol with a combination of all the aerobic, anaerobic, as well as balance and flexibility exercises, which make them to be a healthier. Our ultimate goal should be we need to make the patient to be more independent, come back for the social participation of communication. Okay. So the best outcome measures which we need to use is the community participation. And we need to make the patient come back to the community participation and independent in their life, which is the ultimate measure which we need to set as a goal while implementing exercise intervention. Usually the protocol will be of 3 months, and even we need to advise them in addition to the supervised exercises such a way that maintenance or conditioning exercises, importance of conditioning exercises be explained very clearly. Ask them to follow the packet diary so that they can also remember and they can also pick whether they have been regularly doing the exercises. So in addition to exercises, as I told already, some of the other exercise interventions also need to be concentrated or focused so that to make them a complete well-being of the individuals. One is especially stress reduction, some mindfulness activities or some gaming activities nowadays came along with the artificial intelligence, so which can be taught to them so that real-time environment can be there and they can also motivated to do some of the stress reduction exercises and yoga, a simple form of yoga, meditation, which also make them be more healthier. And another important area where we need to focus is the sleep hygiene. Even nowadays the young generations are lack of sleep and addict to the social media, so digital media. So definitely, so we need to taught them the sleep hygiene, when to have their dinner, when to do some exercises, and when to get up. So all this sleep hygiene is important. In addition to that, some of the risk factors like smoking cessation, lifestyle, sedentary lifestyle. So all these advices should also be given to them. And even dietary advice is also very important to avoid all the junk foods, fried foods, and make add of more greeneries, plant foods, and some protein-rich foods, so that make them healthier. So, as a whole, I want to inform that not only the physical activity, in addition to that, a holistic approach, a patient-centered, focused approach, implementing along with the other team of members, so that we can make them to be people to be a healthier one in the community. So, as advice for the physiotherapist, to be a longevity of the people in the community, first they need to go with the early screening and the risk identification. So it can be started with a lot of small community camps where we can identify earlier and we can screen them and identify the risk. Once the risk identification has been done, promoting active aging across the lifespan can be continued. And finally, community-based programs also can be done. Even sometimes interdisciplinary collaboration also play a major role, so that other, for example, psychiatrists, counseling psychologists, or when some physical medicine people, cardiac surgeon, cardiac physician. So everyone as a team, we can discuss, we can go ahead with the single goal of patient longevity. That is very important. So being a physiotherapist, even sometimes we will refer, we will identify a few of the risk factors, few nature of the patients, where they have been lagged through our treatment intervention or through during the time of the exercise program. So which can be immediately referred to the other team of people, thereby to sort out this, make them more longevity. But in addition to this practice, few challenges also there in doing the practice, because they are older people. Adherence to the exercise itself play a it's a very difficult task for us. So we need to explain to them very clearly about the importance of exercise and how far it is going to make changes in their lifestyle, and how it makes healthy the heart, thereby their lifespan. Similarly, the cognitive decline also happens to the geriatric people. So if they become older, the concept of understanding the exercise protocol, remembrance, and perfection, timing, so all these things will be very difficult for them. So slowly we need to give them some cognitive related exercises through with the advanced technology or some equipments with the AI technology or digital related technology, which again promotes them to go with the real time environment, thereby they can be motivated. And additionally, comorbidities also will be there, so which also need to be focused while giving the exercise protocol. So if the patient is having a hypertension or sometimes any respiratory illness, chronic illness, some exercise-induced illness. So all these things should be very clearly screened, and based on their comorbidities, we need to overcome that. And, we need to concentrate along with the exercise protocol, these comorbidities. Additionally, the motivation barrier. Already they are so depressed, the lack of community participation. So they will not cooperate to come for a community participation and for this exercise. So definitely we need to motivate them. And the best way of motivation for this age group is a group therapy, which definitely helps them to join with the similar age groups. And as a group, if they are doing some sort of activities or some sort of simple free exercises, so which makes them to be joyful, more happier with even combined with the light music, uh, music therapy. So this will help them to participate more. So thereby we can able to manage the motivation, overcome the motivation barrier also. So ultimately, strategy for uh, strategies for success. What are the strategies we need to implement so that we can make the healthy lifespan of the individuals in the community? First, we need to set a smart goal. The smart goal should be explained very clearly to the participants or to the patient. Smart goal is nothing but specific to the uh, target which we need to do. Purpose of a exercise specific to their goal, and this exercise goal should be of a measurable, and should be how much duration they are doing, and achievable also. So whether they can able to do. If they have been not done, what is the reason behind that? And the R stands for relevant, whether it is relevant to the goal. And next, another important thing is the time bound. We need to keep a time frame. Even some patients, they will not, they will easily tell the reason that I don't have time. So they need to have a timeline, uh, particular time where they need to do regular goals of exercises. So the smart goal should be implemented, should be advised to make a packet diary such a way whether they are fulfilling this big protocols. Another strategy where it can go for success is the motivation. So we can go with the motivation, or we can give a peer review to the other patients, or feedback from the other patients, how they have been previously and how now they've been after the achieving this smart. What are the benefits they had? So the life changes happens. All this can be given the interview, and thereby we can motivate the participants so that to make them a success. So similarly, group therapy, as I said previously, related to social engagement. Some activities, like for example, uh, towards the social engagement, plant sampling can be arranged for some other occasion along with these people, and some laugh therapy can be arranged. Some small trip nearby their place, such that which look so greenery and the pleasant atmosphere, where they can do some sort of activities, some play therapy, so that something they have done on this day which fulfill them, and thereby which gives them also some motivating strategy. And even as I said, some of the wearable technology has been there, and remote monitoring technology also there. where we can use this advanced technology to monitor them. The patient can also use this to monitor how far they are doing the regular exercise, whether they can able to achieve, which gives some measurable quantity through this technology. And even some research also says that remote monitoring, for example, patients are in a rural area, very difficult to come for a supervised exercise. Some of the technologies can be sensors are used to monitor them regularly. The remote so can give the feedback of about how to the simple exercise in a correct pattern, uh, how much exercise can be done. All this can also be monitored. So this strategy is very very important to follow, so that definitely we can make some changes in that company. So ultimately, the key takeaways from my session, webinar session is heart health, how it can be done, which is the cornerstone of healthy aging. So if we keep the healthier heart, definitely the healthy aging can be made in the community. So focus, concentrate, each and every physiotherapist can do uh, exercise regimen along with any sort of compliance the patient comes, so that we are making the heart healthy, thereby healthy aging longevity of users in the community. Not only the rehabilitation, even physiotherapy play a major role in prevention. So as earlier screening can make them to be more active and improve the healthy heart. In addition, lifelong movement is the best medicine. So we need to clearly explain them about the importance of the exercise, and also we need to be kind and be a human medicine for each and everyone, so that they will be more happy. Finally, empower patients to age independently. This is the ultimate Tarak Mantra where we need to follow, so that they are also be happy. That their joints together, the community will also be grown well with a healthy lifespan. Once again, I thank all the coordinators and team members for arranging on behalf of World Physiotherapy Day 2025, the theme of healthy aging, the series of webinar. Thanks for the opportunity. Any questions or discussion, we can go.
Dr. Sophia, ma'am?
Yes, ma'am.
Yes, ma'am. You can go ahead with the question and answer session.
Yes, ma'am. Yeah. We now open the floor for questions. So please feel free to share your queries with Dr. Sendil sir.
Dr. Sophia, you may check the chat box once.
Yes.
We can see a question
So
there.
there's a question from Dr. Parvati ma'am. So she's asking if there's any specific screening scale you recommend for 60 plus adults for exercise prescription.
ஐயோ இதான் ஒரு பெரிய ஃபோன் என்ன let them go.
Dr. Sendil sir?
Yes, madam.
So there's a question, sir, from Dr. Parvati ma'am.
Yes.
She's asking if there's any specific screening scale you recommend for 60 plus adults for exercise prescription, sir.
Evaluation, correct, madam, correct. So, madam, the best thing is we need to have a screening tool of measuring their vitals and comorbidities and the medical history. If the comorbidities are there, definitely our protocol will change. We need to take care of more precautions based on the comorbidities. If the patient is having hypertension, definitely the exercise regimen, we should be very careful to avoid or the hypertension should not be it should not be increased or it should not alter the comorbidities. So for that, a safe screening of vitals and the medical history of the patient, along with that, the nature of the which we need a smart goal uh, specific to the individual should be uh, received from the patient. Thereby, we need to train the individualized tailored exercise program.
Thank you, sir. Ma'am, shall we end the session? Is there any other questions?
Dr. Sophia, ma'am, you may go ahead with the vote of thanks for today.
Yes. I sincerely thank you, our resource person, Dr. P. Senthil, sir, in his insightful session today. Our gratitude also goes to our mentors, Dr. Sanjeev, sir, Dr. Ruchi Varshni, ma'am, and Dr. Mercy Jaya Prabha, ma'am, and to our state head, Dr. Parvati, ma'am, with the IAPWC team, Dr. Pratibha, ma'am, Dr. Jayashri, ma'am, and Dr. Chandralekha, ma'am, and Dr. Bharati, ma'am, for organizing this special program. A big thanks to all the participants for being a part of day 2 of the World Physiotherapy Day 2025 webinar series. This is Dr. Sophia McConnell. It's been a pleasure being with you all today. Thank you.
Thank you, Dr. Sophia, ma'am. As we look ahead and forward for your next webinar series, that is day 3 for tomorrow, on topic exercise program designed for healthy aging, and the resource person for that topic would be Dr. Professor Muthukumaran sir. Thank you, delegates. Thank you, the professionals who were as a part of today's webinar. We look forward for you for joining us for this upcoming webinar series. Today was day 2 and we still have more 4 to 5 webinar series more to go, which would be streaming from 1 p.m. to 2 p.m. on IAP YouTube channel. Your enthusiastic presence, insightful discussions, and engaging interactions have truly been enriched the sessions and contributed to its impact. We deeply value the time, effort, and knowledge shared, which has created a meaningful learning experience for everyone. Thank you so much, Senthil sir. Thank you so much, IAPWC Tamil Nadu team.
Thank you, madam. Thank you.
Thank you, sir.